Greetings to all my friends in Jordan. This is Steva Marie Beck with the Nightingale Initiative for Global Health. Happy to be bringing you Daring, Caring, and Sharing, the world community of nurses and midwives creating a future without maternal death. For your excellent conference, The Tipping Point, Creative Solutions to Health and Nursing Challenges. I wish I were with you today, and I envision a time when I can be in Jordan one fine day. Founded on the timeless worldwide legacy of Florence Nightingale, the Nightingale Initiative for Global Health, or as we call it, NI, is a catalytic grassroots to global movement to dare to tell the untold and forgotten stories of global health, to care to empower the public voices of nurses, midwives, and concerned citizens, and to share this opportunity with everyone everywhere. Now, we've been asked again, why Florence Nightingale? Some would say that she was a nurse, an important nurse 100 years ago, 150 years ago. But why do we keep bringing her back? Perhaps she should be just left in the historical archives and remembered as such. But we feel that she is an important, significant icon for the worldwide work of nurses and midwives and even concerned citizens for the 21st century. Of course, she's most remembered as the Lady with the Lamp, the humanitarian nurse who served the Turkish and British soldiers during the 1850s and the Crimean War. Here is a view of the Scutari barracks where she actually did her work, still standing on the Asian side of Istanbul, and a picture of the cots where the men were laying dying and wounded, with her watching them on her night rounds. She is still loved across the world in many, many cultures. As you know, she was a nursing administrator, a nursing educator, and an ardent advocate for sanitation. She was a statistician working on health outcomes and health policy, and she was a pioneering environmentalist. She was working on acid rain and deforestation in India in the 1870s. She was widely regarded for her advocacy for cross-cultural understanding, as I love to show here in this beautiful painting about how much she was loved by the Turkish people during the Crimean War. Hence, she was a leading citizen diplomat of her time, and she actually helped draft the first Geneva Convention by contributing to the British contribution to this in 1864. This Geneva Convention that she worked upon was a key step in founding the International Red Cross and the League of Nations, and ultimately the United Nations, stretching from her time to us today. She was a best-selling author, an activist, an advocate, and a networker, and for us to remember especially, she was a consummate communicator. In her footsteps, we too can be activists, advocates, networkers, citizen diplomats, and consummate communicators. So beginning in 2003, a team of us who felt that Nightingale's work could really relate to the new millennium and the 21st century, decided to create the Nightingale Initiative for Global Health, and we began our work by crafting the Nightingale Declaration, beginning with "We, the nurses and concerned citizens of the global community, hereby dedicate ourselves to the accomplishment of a healthy world by the year 2020. Currently, more than 22,000 people have signed this declaration online from 106 nations, representing several million people, and we are very pleased with this beginning success. Already online, we have created several websites. In the year 2000, this was our initial website. Perhaps some of you remember this design. And then in 2008 through 2010, we collaborated with Sigma Theta Tau International to create this website for the 2010 International Year of the Nurse and the Nightingale Centennial. Starting in 2011, we brought on board a vibrant new website upgrade, which is still available to you today. And we're very proud of what we've achieved with more than 500 graphics, texts, documents, things to share. It's becoming an amazing archive of things available for you to see. But now we say to ourselves, what would have Florence Nightingale done with social media, with blogs and with YouTube? And what could we do together with cooperative social media, with blogs and YouTube and whatever else comes? What could we do in her name? About 2 years ago, we started planning our current answer to this question, creating our Daring, Caring, and Sharing campaign that we are starting this year in 2013 and working through till at least 2015. These are the plans that I'd like to share with you today. We hope to create a wide-ranging global initiative called Nightingale Friends and Circles and a global maternal health awareness campaign. Imagine, if you will, that there are an estimated 35 million nurses and midwives currently working across the world. With even 1% of these, 350,000 people, together, what could we achieve? I did some research on the internet to find that there are 500,000 nurses and midwives in the WHO EMRO region alone, your region. And I was pleased to go and find these pictures from some of your nations: Sudan, Pakistan, Afghanistan, Oman, Egypt, Morocco, and Iran. If even 1% of these people across EMRO, 8,705 people, with this group of people, what could we achieve? Can we dare to widen and strengthen circles of informed concern and relevant action on a world scale? Imagine circles of nurses in all of these places across the world, working, collaborating together to inform the world about our concerns. Now, how would we do this? We are proposing to welcome online individual friends of Nightingale everywhere, individuals everywhere, who would then be invited to create online circles of Nightingale's friends, circles who would be featured as bloggers on our new website, niworld.net. Bloggers sharing their stories be vital and important for everyone to see and hear. Our global vision for the first online phase of the Nightingale Friends and Circles networks is that we might achieve circles in all of these nations, a global portal of online bloggers. We've already created a Nightingale Toronto Circle with a team of students from the University of Toronto, most of them diaspora from Somaliland and Somalia in Africa, and a team of people who are representing NI as UN NGO DPI representatives in New York City. And we're already discussing new circles of Nightingale Friends in Beijing, in Kampala, Uganda, and in Mumbai in India. What might we do in the Middle East? Might we have Nightingale circles in Jordan, in Lebanon, in Pakistan, across EMRO? We invite your involvement in raising public consciousness and informed concern and relevant action to involve the world with what we know and what we can share, to influence opinion holders and decision makers, as well as ordinary citizens, and to collaborate with current and would-be community health workers worldwide. In 2013 through 2015, we are also focused on a global public awareness campaign, Daring, Caring, and Sharing to Save Mothers' Lives. As many of you know, perhaps better than your colleagues and friends in Europe and North America, the specter of death in childbirth still haunts humanity. One mother, one girl or woman dies every 2 minutes, and even one death Even one death a day is too many. But surely more than 750 deaths on average per day in the year 2012 is a cry for urgent action and global teamwork to end this preventable daily tragedy. We all see that safe birthing is a sacred rite of passage for a human life to come forth. It is a privilege that each of us alive today were granted. And I would say that it is an unalienable right, deserved by every mother, to be able, if at all possible, to deliver her babies safely. And while this suffering continues, the story of maternal death remains underreported and little known worldwide. Occasionally you hear it mentioned, but most people do not know this is happening daily. But what can any one of us do about this? It seems a vast problem. One mother, one woman or girl dying every 2 minutes around the clock, 24/7, 365 a year. To address this in an innovative way, the Nightingale Initiative for Global Health team around the world decided to create the Daring, Caring, and Sharing campaign to save mothers' lives, sharing this story and its solutions with humanity across the world, caring enough to collectively correct this situation. We must therefore be daringly creative enough to ask, why is this still happening? Why is this problem neglected and unknown? What can be done about it? Who can do what, and where are they? What will it take to resolve this dilemma, and how will this action be supported and by whom? You know, I'm willing to wager that the people at your conference know the answers to these questions. It would be fantastic to share what you know with the world. Can we dare enough, to care enough, to share enough to find solutions and answers to these questions? Across 2013 to 2015, we at NI will be encouraging and engaging our Nightingale friends and circles to answer these. We will seek to share stories of individual competence, compassion, and courage, stories that are demonstrated, enacted, especially in the rural villages of the world where this problem is greatest, to abolish the scourge of maternal and infant death. We seek to care to identify, document, and communicate needs and deeds of nurses and midwives. And we invite your support, experience, and participation as partners in this campaign in the common cause of universal maternal health. If you have a mother, are a mother, or know a mother, please join us. Imagine daring, caring, and sharing to save mothers' lives. Now here's how you can participate online with us at www.nightingaledeclaration.net. If you haven't done so already, please sign the Nightingale Declaration and network for others to also sign. Everyone is welcome to do this. You can participate with us also by checking out our Daring, Caring, and Sharing campaign featured on our homepage, and then choose how you might participate. You can even be a partner in this campaign, sharing your experiences and ideas about maternal health. In addition to sharing, which we would love to hear from you, you can also contribute as a partner. Help us to sustain this effort. $90 for an individual and $60 for senior and $30 for students. This would be just a one-time contribution where you would be a partner recognized as such. And you can, of course, you can donate any amount and we would appreciate it. If you think you can find community partners at $300 a level, hospitals and nursing schools, associations and organizations, we would be happy to send you a premium gift of the deluxe edition of Dr. Barbara Dossey's Florence Nightingale, the beautiful, beautiful copy table illustrated biography. Consider creating Nightingale circles in Jordan and across the Middle East. We would welcome your contributions to what you really already know about maternal health. Please please contact me further about this. And if by chance we could create an Arabic version of this work, we would love this, and we envision it. We would love to be in collaboration with you about this. Please contact me further. Imagine with me again Nightingale Friends and Circles worldwide in each of these places and perhaps more, posting, blogging, sharing their stories about the solutions that nurses and midwives are achieving for maternal health and for child health and for primary health worldwide, telling the story to the world about how this problem can be solved, about how each of us, as individuals and as groups, in communities, regions, and nations, can be daring, caring, and sharing to create a future without maternal death, and actually be part of the tipping point, creative solutions to health and nursing challenges. Thank you so much for listening and watching and participating in this conference, and for welcoming me to share this in a virtual way with you. Perhaps it is fitting, with our desire and our vision to create virtual circles like this around the world, perhaps it is fitting that it is a virtual presentation that I bring you today. In any case, thank you so very much. Wishing you all the best for the rest of your conference and for everything that you, each of you, is achieving for nursing, for nurses, and for health across the world.